You're listening to the Safe Tea podcast, hosted by Nicky Brownjohn, where we talk all things safeguarding over a cup of tea.
Welcome, Anita, and welcome everybody to the second Safe Tea podcast. I'm Nicky Brownjohn. I'm the independent chair of the Brent Safeguarding Adults Board, and I'd like to introduce Anita Silberbauer, who's come to talk to us today. Anita, would you like to tell us a little bit about what your role is?
Hi, Nicky. Thank you very much for having me. Yes, my name is Anita Silberbauer, and I'm the Crisis Skylight Director for our Crisis Skylight in Hull and in Brent. We are one of 3 Crisis Skylights across London, and we support homeless people in Brent and surrounding boroughs.
That's lovely. Thank you, Anita. And so what we're here today to talk about is around sort of some of the tricky issues around homelessness and some of the underlying factors that lead people to be homeless. So sort of thinking about safeguarding and homelessness, so safeguarding foundations, how do you define safeguarding in the context of homelessness and substance use?
I think for us, safeguarding isn't just about raising a safeguarding alert. I think it's more than that. It's prevention of harm. It's protecting individuals who are unable to protect themselves. It's responding to risk. It's validating people's experiences and needs. And overall, it's empowering individuals. I think homelessness and substance misuse are not standalone needs. They're part of other care and support needs that individuals experience. And I think multiple exclusion homelessness is bounded about, and if that just covers everything, because homelessness on its own isn't a safeguarding need. But when you look at all the different trauma and all different experiences that somebody's gone through, then that makes a lot of people a lot more vulnerable to abuse and harm because of the circumstances.
Thank you. So thinking about the complexities that we might have to deal with, and thinking sometimes quite small s safeguarding, really. It might be safeguarding and concerns and referrals raised, but to the statutory safeguarding, but not always. It's that smaller, that prevention, and thinking about the 6 principles of safeguarding as well, isn't it? What does effective safeguarding look like on the front lines of your work?
Well, I think it's ensuring people are protected from harm and abuse, really. Often there are people falling through the cracks, and we want to make sure that people are supported. I think it's important to know when you have to make a safeguarding alert and when that's the right thing to do. But sometimes it's also just as important to highlight the complexity of needs and all the different experiences that somebody fights, and then together work out what the best way forward is, because what we don't want is vulnerable people not getting the support they need and not getting the protection they need as well.
And so how do you build trust with people who may have had negative experiences with those formal statutory services or institutions?
Make sure that we provide psychologically informed spaces, and to make sure that they are available where the vulnerable people are. So in the community, it's bringing those spaces to people. We're quite lucky here in the Skylight because we're on a very busy high street. We're on Halston High Street. We do get people coming to us, and I think people feel a lot more comfortable approaching an organisation like Crisis, where we're in the community, rather than maybe walking into a civic centre or a local authority department. I think that is helpful. I think definitely recognising the complexity of needs and recognising that not every day is the same. The presentation of an individual during an assessment may be very difficult to the general presentation. And I think acknowledging that maybe there hasn't been a prior relationship with a social worker who carries out an assessment is really important, because individuals react differently to questions and differently to people they don't know. And the other thing is being mindful of the language and the approaches we're taking. I think ensuring that empathy amongst high caseloads in various teams or departments or other pressures remains at the forefront. We totally recognise people are stretched. People have got lots of different pressures, but I think that kind of empathy with the individual in front of you is really, really important. And we try to always put that in the forefront of our work. And I think tenacity and persistence is something that we just all need to kind of hold up, really. We had a member that came to us who sort of screamed at us for the first 3 times that they came into the centre, throwing themselves on the floor, just really sort of being really unwell and in the way they were presenting. But now she feels comfortable to access our services. And we made sure that we looked after the individuals at that particular point, were empathetic and mindful around what they were experiencing in that particular moment. And yes, it took a few hours to support that person, and they had gone into the showers and we facilitated that. And it took us a couple of hours to get them out of the shower. And we took a couple of calls to the ambulance, and it took a couple of calls with other agencies. But it was amazing that we were able to support that person in that moment. And we've had feedback from the outreach team to say that the member was thankful, and I'm really glad to say that she's accessed the service twice since then. Although for us it was a lot of chaos, I'll be quite honest. The person themselves really appreciated that she was somewhere that was safe and she had people looking after her.
So there's something about making sure that the service is flexible and adapts to meet the needs of that person, and making that a safe space for that person. And I think also what I've heard from people who maybe have struggled with some services is they respond to respect. And so giving them that space really gives them that respect, so they'll come back and not being judged as well, isn't it? And it is, as you say, it's very easy that when we have very busy workloads that we need people to fit into our box rather than for us to be adapting like that. So it's a really good representation of that. So moving on to sort of maybe thinking about substance misuse, which seems to be sort of a key challenge. And so just wondered, what misconceptions do people often have about addiction among homeless populations, and how do these affect safeguarding?
Well, what we're often hearing is that rough sleeping or substance misuse is a lifestyle choice. And these kind of generalized comments are really unhelpful. The complexities that some individuals are presenting do not result from one incident. There's lifelong trauma, there's cycles of abuse and rejection. And yes, often substance misuse is a play as well. Many individuals that we support have had negative and traumatic experiences with people in authority or with services, and there is no trust. So often that comes from bad experiences in terms of the support that was available, but sometimes it's also because somebody's needs are too high, or sometimes they're not high enough. And sometimes that kind of lack of engagement is dealt with punitively, we find, and often regarded that the person doesn't want to engage or is refusing to engage. But what I'm kind of thinking is, are we asking the right questions? For example, are the services that we provide meeting the needs of these individuals? There is a really amazing project called Housing First, which is a brilliant way of providing long-term support to help individuals stabilize and move forward with their lives. And it's all built around giving somebody a home first and putting all the other support, all the other services around that individual once the housing need is sorted. And I think this is a model that's held really highly regarded in many European countries, and there's also some great work done in the UK, and then Crisis run their own Housing First project. So I think that's where we can learn from it. Housing is one of those stabilizing factors. And then once that is in place, we can look at what else needs to put around an individual.
How do you support people who may be simultaneously dealing with mental health challenges as well as the substance misuse?
It can be difficult. It is difficult. But what we're trying to do is sort of wrap around the different services, so that statutory health, community, and the support networks around an individual who's often unable to engage with services. And often it's a difficulty in terms of engaging in structured ways, attending appointments, or sitting through assessings. I think it's really important to create safe spaces when people need them. It's really not to be underestimated. And I think partnership work is crucial. Reminding ourselves that within our pressures and limitations, we're trying to resolve issues that are relating to an individual in front of us. And understanding each other, and the flexibility and the collaborative approaches that we all take is really, really important. Something that we've tried to do here in the Skylight in Brent is bringing other services into our spaces. it is much easier for somebody who's very chaotic or who's got care and support needs to access the services where they're comfortable, where they're already engaging, rather than having to make a trip to another agency where they don't know anybody, where they don't know the location, where they don't know the space. So that has been really, really helpful. And I'm really want to expand that a lot more. I think that's a positive for the individual, for us, but also the partner organizations who can really help the people when they're needed. And I think another one is the multidisciplinary team meetings, bringing people together in other spaces, and definitely advocate other services to get involved. Our specialty, our main aim is or experiences around housing and homelessness, but we know that we can't often resolve everybody's issues, and we need to bring others on board with us and wrap around an individual.
That's really interesting. Thank you. Sounds like some really good practice. And yes, as you said, it's about keeping that person safe. But I know I've been to the Skylight, and it's just in the middle of the street. So easy to get into, not again, sort of just being able to just walk in there, being able to then have other services that someone needs in that space, rather than having to, okay, so you found us, but now you've got to go get on a bus and go elsewhere and find the next service. It's an awful lot to do, isn't it? Thinking about, sort of just the daily routine and sort of working in outreach, what are some of the common safeguarding challenges that staff might encounter when they're doing outreach?
So Crisis actually doesn't provide outreach. In Brent, we've got Mungers who run the rough sleeping outreach team, but we do work very, very closely with the outreach team. In our Skylight, we predominantly work with rough sleepers, so there's a really strong connection. And again, what we can provide is a safe space. We've got the Skylight, we've got the building, we've got the facilities. There aren't really any day centres in Brent as such for homeless people, and we're really pleased that we can offer shower facilities, laundry facilities, kitchenette facilities for people who are rough sleeping, especially, to come and make use of those. But I think recently we're seeing a lot of vulnerable women coming through our doors, and that's really interesting because we're also hearing this from many other agencies. And women are not always visible as rough sleepers. They're more likely to stay in 24-hour food outlets, on transport, they're moving around, often very unstable and unsafe day-to-day housing transactions. They're engaging in potentially ad hoc sex work to secure accommodation for a night. So those women rough sleepers don't appear on the national statistics. They're not verified rough sleepers because it's too difficult, too unsafe for them to sleep outside, to be bedded down, which is what you need to do to be verified on the chain database. So they're kind of not visible, but they do exist, and they're rough sleeping, and they're very, very safe circumstances. So we're seeing a lot of those women, and it's really important for us to reach out to them because we know they're very vulnerable, and we want them to come into service, and again, to bring them in, to wrap the support around them. And that's not just housing, that's also other things that they might need. But some of the support needs are very high, and often what we find is that if somebody is offered temporary accommodation, for example, because they're rough sleeping, they're not able to keep that accommodation. It's very, very difficult sometimes, even when you place somebody, that they can keep this. Often it's a house where there's other people with high vulnerabilities, with other complex issues, and it might not be safe there either. So it's really important to kind of recognize that just placing somebody somewhere isn't the end of it, and it needs to be stable, and it needs to be appropriate and safe accommodation. And I know that's a whole different story, but it's very, very tricky, especially when you're looking at vulnerable women or women with high complexities, and especially if they're also linked to mental health and substance misuse.
So how does that work with the women? Are they able to access Skylight? And if there's the men there as well, how does that work?
Good question. So we did try and create women's spaces, women-only spaces. We think that we would like to expand on that a little bit more, and I think it will come. Again, it's like persistence and tenacity. It's like sticking with it. If women know that, say, every Friday afternoon, it's a women-only space, I think word will get round either from the group themselves or from other partner agencies that we offer this. So we've done it on previous occasions, and the take-up was fairly low, but I think it is about building trust, linking in with other agencies, for example, via who are just down the road running a women's project helping women exiting sex work. And I think it's important we look at these complexities, these needs, not in isolation, but where we can offer some support. And if that's creating a women-only space, then we're very happy to do that, where we can look at housing, substance misuse, mental health, and all of these things in one place.
That's really helpful and really interesting, and shows how these things evolve over time, and it needs time, persistence, and and that confidence and courage to sort of just keep taking it forward. Within homelessness services, how do you take a trauma-informed approach?
I think the most important thing is to put the person at the centre, to build trust and respect. Most people that are coming through our doors often haven't had a positive experience with services, or many of them also haven't had positive and stable and supportive relationships. And I think kind of putting the individual in the centre of our work is really important. We're taking a slow approach. We're lucky enough to be able to work with somebody according to their pace, according to their needs. But we're also able to move quickly, especially if there are safeguarding concerns, that we move quickly with this. But I think it's important to say that we're not as restricted to around timeframes and working with somebody. I think it's also really important to explain, and this is where language is so important, to explain what we're doing and why we're doing it. So making a safeguarding alert saying, oh, you're being cursed by your partner, what does that mean to somebody? They think that that's their only relationship. They're not going to hear that. They're not going to hear that necessarily is a bad thing. And I think it's kind of explaining in a way that the people would understand that what they're experiencing or going through isn't okay, isn't appropriate, isn't safe, but looking at it from their point of view and just explaining that. I think that's really, really important. We've actually had a lady we were working with, and we're trying to explain that their partner or friend taking their benefit money and withholding the card and withholding the phone is not okay. And it took us the third session until she said, I think you're right. I don't want to be in that kind of situation anymore. But the first two sessions were quite difficult. It is a difficult subject, and we knew that they were having a close bond, whether that's a safe bond or not. So I think the language is really important. Again, it's something that you can build on if you've got a little bit more time. If you've only got like a 20-minute or half an hour assessment, whatever that might be, to kind of ask those really personal questions. A stranger, you might get a different answer. You might get different feedback compared to when you have got a little bit of time to build a bit of rapport and trust. So I think our work kind of builds around things like safety and trustworthiness, but also actually choice and empowerment. I think it's really important that we're not doing things to people, but with people. Unless there's emergency situations and we need to act quickly. But I think what safeguarding is as well is putting the individual at the center of their journey and being able to empower them to take some of those decisions. It's not agencies taking decisions because they know better. It's agencies explaining what could be the options to keep somebody safe. And I think then the individual feels more confident and more comfortable taking those very different and very difficult decisions that they have to take.
And with that trauma-informed approach, that you need to absolutely go at their pace, don't you? And because we might see that what they're going through is absolutely wrong, and why on earth won't they accept it? But actually, they might be in their 20s and they might have lived their whole life in this different relationships, but restrictive relationships. And so they can't see outside of that. It's like being in a forest, isn't it? And not being able, never having seen outside, so not being able to see what the mountains could look like outside. What changes would you like to see in the wider system to improve safeguarding outcomes?
Specifically around homelessness and substance misuse, and the issue around dual diagnosis, if we throw mental health into it, there's often the sort of the age-long issue around dual diagnosis. So mental health services won't accept anybody who's using substances. Substance and detox services don't have the space, are unable to engage with somebody because of their mental health. So it's, again, a lot of people falling through the cracks, and it needs more of a concerted effort. And I think the changes that I would like to see are definitely closer collaboration with agencies. I think especially in the times of limited resources, but actually all the time, we need to lean in on each other. Charities and outreach teams may work on engagement and building trust, but there are limits to what we can do. And we and the individuals we support need to have confidence that their support needs are addressed in a person-centered way, and the different partners are working together to provide support. I think that's really, really crucial. Having knowledge and more awareness of safeguarding, the safeguarding teams, what they do, what is their remit, is really, really important. I think for individuals who might raise safeguarding alerts on behalf of somebody else, but also for partner organizations or local organizations who are considering raising a safeguarding alert. It's not just about the safeguarding alert. It's what can we expect around it if it's not taken as an alert. It's what are the next steps. It's being informed, knowing what's going to happen. That's the crucial thing involved. I think raising awareness around homelessness and substance misuse is important as well. It goes both ways. I think we want to know more about safeguarding and adult social care. What do you do so that we can support it? But I think we can also offer what we do to those teams. We've actually just been approached last week by the local police team who have told us that Halston High Street is one of their hotspots for ASB and street drinking and begging. And we felt that offers a bit limited understanding of like, oh, well, if they're homeless, why don't you house them? Or you haven't seen them for a while, but they're off sleeping. They're probably staying with a friend. And it's a little bit more complex than that. And we would really like to share that information and say it's not that easy. You're not just presenting as rough sleeping at the local authority and you're getting accommodated, not even for a night. There's certain criteria to meet. And the same for like character assessments. It's not that easy to get a social care support. There's assessments to go through, there's thresholds to meet, and that's all okay. But I think just understanding a little bit more what we all do, I think would be really, really helpful. If I may, I can talk about one of the projects that we've been doing recently, which is under the Built for Zero project.
Yes, please do. Please do.
Built for Zero is sort of a methodology that came in from America, and really excited that Crisis was able to run this with Brent. The aim is to make rough sleeping in Brent rare, brief, and non-recurring. And we are working not to the general rough sleeper verification having to be bedded down. It also captures people, like we talked earlier, anybody rough sleeping who's on buses, who sleeps in food outlets, and who might not be verified. And so one of the projects we did, it was called a 90-day sprint. We focused on long-term rough sleepers and aimed to house 20 of those, 20 long-term rough sleepers, so minimum of 6 months on the streets in Brent. And we knew that the systems needed to flex in order to achieve this. So we got sign-off for flexing from very senior leaders who recognized that creative approaches do not open the floodgates for everybody, but that these are pilots from which we can start to help individuals. And it was amazing. We had adult social care, we had housing, and it was brilliant because they said, yes, do something different. Let's try, let's flex here and see if we can get those long-term rough sleepers into accommodation. And it was brilliant because we found that we could help people when we worked together and we flexed the systems. We were able to gather really good data about what were the needs, what was the barrier, and how could we overcome that barrier. And ultimately, we got a lot of really good learning from this and how we can end homelessness on a very specific cohort in a very specific place with the support of agencies that are all aiming to work together to end homelessness. So this was a fantastic opportunity. We did get 11 people into housing, which was amazing. I think it's those kind of pilots, those kind of bits of creative work where somebody takes a little bit of a leap of faith and says, yes, let's try it. It doesn't quite fit our remit, but as long as it's safe, as long as it can make a difference, why don't we just try it, take learning from it, and then see what else we can do from it.
It's just so brilliant. And the way you describe that and your passion for it comes through, that really represents what you've been talking about being person-centered, being safe, but flexing the service for them. And that's the way that we can help them. And that coming together for that creativity and having an impact, that's really excellent. Is there any long-term look at the impact for those 11?
So what we have with Built for Zero is a by name list, which is a list that captures all rough sleepers that we and our partner agencies are aware of in the borough. And we do track the progress. So we know how often we engage with them, when we've last met with them, have them moved off the street into somewhere else, have they stayed there. So we do track people's kind of journeys, people's progressions. And we're really excited to think about what our next 90-day sprint could look like and who else we're focusing on. But I think these small pilots are really, really helpful. And it takes some, senior leaders to give us the backing on that and for us to work together to achieve those good outcomes.
And really and enabling that charity voice to be really, really loud. That's really great. So you've spoken about partner agencies, but how can the public and communities play a role in preventing crisis situations before they happen?
It's the same way that we want to raise awareness around homelessness, because that's what we do. I think it'll be great to make sure that everybody's more aware of safeguarding. I think, again, what it is, who to contact if there's a concern, what sort of a response somebody can expect, even better if timelines are given. And I think we need to demystify what safeguarding is. It doesn't just mean care homes and investigations and stress and stigma. It is about preventing that harm and preventing the abuse. And I think individuals or organizations just really feeling comfortable and confident in making and raising a concern or making an alert. Even if it isn't an alert, we've raised something and we want to link that person then into the most appropriate services. So it is not looking away and fearing that people doing something wrong, that we're adding to people's waiting lists or pressures. It's we're doing it, or somebody's doing it because there's a clear concern there and we want to help the individual. So maybe some awareness raising or something else. And the more we bring this into the community, the better. We can put it in the Brent magazine or, us professionals maybe talking about it. But how do we bring it to maybe employers? How do we bring it to community settings, to faith groups, where you might observe something that isn't right and that kind of causes you concern? And I think it's filtering that all the way through so residents and our communities become a lot more confident in safeguarding and talking about it.
What gives you hope in this work that you do, despite the challenges?
I think it's small successes. Knowing that somebody who's experienced harm or abuse has been removed from the situation or has support in place or is acknowledging what situation they're in and is willing to do something about it. That gives us purpose, and I think that gives us hope. It's also really nice to see agencies coming together to support individuals and seeing it as real collaboration. So putting the individual in the centre and building a work around the person. Sometimes we're working in silos, whether that's within our own organisations. But when two teams or different teams come together and kind of realise that together they can achieve more, then individually it's a real sense of achievement and progress. And I think, as we talked about it earlier, this kind of willingness to flex, it's new and it's really exciting. And we know there's a lot of challenges. Giving our frontline workers who've got experience and ideas the freedom to be creative. This is how we can repay our admiration for what they do, really, because they know and they've got so many different things, and every interaction I think is, I could have done this worked really well. I'll try this again, or maybe I'll phrase this differently next time. It's kind of the constant learning, the kind of reflecting on situations. So I think let's not shy away from trying something different if it can be the solution or if it can make a difference to somebody. The final bit that I got from a colleague as well was willingness to fight for an individual. So it's the staff, it's the teams, and also the leadership demonstrating what good looks like, discussing cases, discussing the challenges that we're facing, and coming up with joint decisions and joint ways forward.
That's really excellent. Thank you. And that joint discussion might be dealing with the person on your own, but actually always discussing those tricky issues. So it really represents good reflective supervision, and that we are in a very difficult space. We're working in a difficult space, and so not normalizing what's going on, but that thinking creatively, being enabled to actually do that and not think, actually, that didn't go so well that time, and not being told off for that, but actually continually learning to make a difference, because we're dealing with people who've been through difficult situations in their lives and might not respond to us in the way that we might expect they should. And so turning that around, and that actually, how can we respond better to them to get a positive response from them. So thank you so much for that, Anita. You've really given a really good overview of the work that you do and how that links in to safeguarding.
Nicky, thank you very much for having me. And we are really passionate about collaborative and partnership working. And I do hope that maybe with this, or maybe with our attending and joining different kind of spaces and networks and meetings, we can really promote that message even further. I don't think we can resolve any of these issues by ourselves, and we're much stronger if we work together. So I'd be really keen to kind of, continue those conversations around this.